some of the issues that are going to be clearly part of this debate, and we talked about the town hall meetings, the health care bill that was passed earlier this year. And we did have clips on this show of one of Mark Schauer's post-vote town hall meetings. And that was interesting, but again, it was past the time of seeking input, and he was just kind of explaining to the crowd what was going on. But let's talk about health care. I know that some conservatives and Republicans out there have talked about repeal and replacing the current health care bill. Any thoughts or any plans of how you might stand on what to do about the health care issue?
Sure, I signed the pledge to repeal and replace, but I also know reality is President Obama is going to be our president until at least 2012. So until we get to a point where we have the ability to do that, the reality is that we have to try to fix what we can. We know there are things that are already broken in this bill, things that weren't thought out, and that's what happens when you have bills that are crafted literally on the weekend at midnight behind closed doors without it being vetted by the public. It wasn't on, the White House website like it was promised to be for however long they said, 5 days or whatever. Mark Schauer took credit for writing large swaths of the bill, and yet he wouldn't tell us exactly what was in it either. We know that, I'm a veteran, so for one small instance, TRICARE, which is what veterans and active duty folks live off of as their health care, wasn't specifically mentioned in the health care bill, so it wasn't clear whether or not that was a legitimate health care provider as defined by that bill. And so if it wasn't, then that means everybody's off health care and they have to get dumped into Medicare. So they had to do a fix right away to make sure that TRICARE was part of that. Same with the VA system. I believe it was the same as the VA system. It shows you, if you were thinking about veterans issues, or you're thinking about veterans, or you really had a lot of a forethought on this bill, why didn't you, make that fix from the beginning? It's because it was rushed. It was jammed through the Congress. It was signed by the president without, a lot of vetting being done. And unfortunately, when you have a government that has the power, and they do, then you can force things down America's throat, even though 55% plus did not want this bill. It's the first time, I believe, in history that any bill of this magnitude was passed against the people's will. So you have a crisis of consent going on right now. So they have the power and they're jamming it through. They are going to pay for it, but it's hard to unwind things. I think, though, that this is the kind of bill that you need to unwind. Don't get me wrong. I'm not against health care reform. I have a son with a pre-existing condition. So if I don't win this election, I'm on COBRA right now. What happens if I don't win this election? Next job I go to, they'll say, well, you have a son with a pre-existing condition. Not necessarily a case in Michigan. I'm saying a case that maybe another state that they don't cover pre-existing conditions. Then they say you can't get a job, or your son's not covered. Same with my son. If he wanted to get a job as he got older, I don't think it should be a requirement of work that you have some issue that's been corrected that you can't get work and get coverage for it. Michigan is a great example of one of the things the Republicans were talking about, and one of the things I thought about is that Blue Cross Blue Shield did cover pre-existing conditions. And so when you talk about competition across state lines, people that have pre-existing conditions or their children say, you know what, Michigan's got a good program up there. I'm going to get my health insurance from up there. That could help the other states to say, I need to get business there as well. So you attack things on a bullet-by-bullet approach rather than this shotgun approach the Democrats use. They're making a sausage. They don't know what it's going to be like on the other end. And really, to affect 1/6 of the national economy, to turn health insurance into essentially utilities where the government tells the health insurance providers what they can and can't do. It's a recipe for disaster. And, you see what's going all over the world with nationalized health care, and it's not a success story. America right now has the best specialized health care in the world. We can do better because we are an exceptional country, and we shouldn't model ourselves after Western social democracies like Western Europe.
Well, I know even during the debate, and being an attorney, I know you probably haven't done any malpractice or anything like that, but one of the reforms that was put forth by the Republican side was tort reform, medical malpractice reform. Do you see that being a benefit that might be a part of the replacement bill?
Well, absolutely. I mean, look, part of politics is who pays you a lot of money. The trial attorneys pay the Democrats a lot of money. And lo and behold, there's nothing in the bill. I mean, there's a tiny, tiny, mean-nothing provision in the bill about tort reform. If you really cared about it, you'd do significant tort reform. And you need to get rid of punitive damages, or cap them at least, and work more on the compensatory side. And punitive damages are, we're going to make this doctor pay for what he did. In my mind's eye, as a former prosecutor, prosecutors should make doctors pay for something they've done illegally. You don't need to punish somebody through monetary damages. You can put a cap on it like California did. Michigan has something similar as well. That should have been in the bill, but they were beholden, meaning the Democrats, Mark Schauer, to special interests, and that needs to be a fix because we know that that will lower cost. This bill will not lower cost. All this bill does, and Mark Schauer goes around in his town hall saying your Medicare benefits won't be affected. When I hear that, I hear it's like lawyer speak. Yeah, your benefits won't be affected. You'll still rate your benefits. Your access to them might be completely cut off. For instance, I have people tell me, well, you were in the military for almost 9 years, and military has good government-run health care. Yeah, it's good, but our population is 17 to 45, which generally don't get that sick. Or if they do, we have good catastrophic care for, someone loses a leg or something like that. But getting old, hip replacements, knee replacements, it's not as good. Or for me, I have a degenerative disc in my neck, so I have a 10% disability, the VA rates. Not a huge deal. But when I wanted to find out about that, I had to go to my primary care doctor in the hospital at Naval Station Balboa. I have 15 minutes to make my case. If I don't do a good enough job, I get my vitamin M. And that's 800 milligram Motrin. And I have buckets of that stuff all over my house. They say since I can treat my pain with medicine, that I don't need to get an MRI. So my gut gets eaten up, but my pain goes away temporarily. You know why they don't want to give me an MRI? Because there's one machine on the West Coast where I was at Balboa, and there's a year wait for it.
Wow.
That's saying I rate it, but I don't have access to it because I can get my pain treated through vitamin M, and that's not the kind of system we want to have for the rest of our country. I don't want to be running on, not to belabor the point, but I don't want to be running on in the future instead of whether we're going to have nationalized health care or not, how many MRI machines Michigan's going to get. I don't want to be the politician that says, I'm going to get you 10 more MRI machines. That's not the way we should work in this country.